Dexamethasone. Trade names are Decadron, Dexasone, and Asium SP. Its classification is a steroid, which is a synthetic corticoid, and it's an immunosuppressant as well. Its mechanism of action is that it inhibits multiple glucocorticoids. The name glucocorticoid, or GCs, derives from their role of the metabolism of glucose and their synthesis in the adrenal complex and structure with the steroid. GCs are part of the feedback mechanism in the immune system that turns immune activity, which is inflammation, down by binding to the glucocorticoid receptors. Indications for use are cancer, brain tumors, to help counteract the side effects of the anti-tumor treatment that the patient might be receiving, allergic disorders, arthritis, skin conditions, lupus, ulcerative colitis, pulmonary edema, breathing disorders, as well as high-altitude cerebral edema, and is commonly carried on mountain climbing expeditions for that reason. I recently performed an autopsy on a cadaver so I could draw this picture and more accurately describe to you the pharmacokinetics on dexamethasone. Basically, it's readily absorbed into the tissue, then rapidly distributed to the liver, muscle, and intestines. It is metabolized in the liver and primarily excreted by the kidneys and then urine. The drug forms are solution, ointment, and pill, and the various routes of administration are IM and IV, as well as topical and sub-Q. In regard to the dosage, it's really varied for both pediatrics and adults and must be individualized on the basis of the disease under treatment as well as the response to the patient. So it's best to contact medical control first.
It's painful and swollen. I have tried many medications and they do not work. What should I do?
Me too. I take dexamethasone. You should talk to your doctor about getting it.
What does it do for me?
Dexamethasone is a potent glucocorticoid class of steroid used to treat many inflammatory and autoimmune conditions, such as rheumatoid arthritis. It is usually taken when other drugs do not work.
Are there any side effects?
Yes, some common side effects are excess fluid or swelling in the face, hands, or feet, slow wound healing and increased blood glucose level. Some adverse effect can be local inflammation and infections as well as burning and stinging sensations.
What do I need to know before taking this medication?
Do you have diabetes? Any ulcers? Are you pregnant? If yes, you shouldn't be taking this drug.
Do I look like I can get pregnant?
With you, anything is possible. You also need to know that any fungal infection or being near anyone who is sick with an infection can be a contraindication.
Side effects include upset stomach, peptic ulcer, CHF, anaphylaxis, osteoporosis after long time use because of the stimulation of bone marrow, pancreatitis with pediatric patients, adrenal insufficiency, as well as steroid psychosis. Contraindications include existing gastrointestinal ulceration, Cushing's syndrome, severe forms of heart insufficiency, and severe hypertension, systemic tuberculosis, severe systemic viral, bacterial, and fungal infections, as well as osteoporosis. As far as special considerations go, pregnant patients, it's a Class C drug. For mothers that are lactating, they say it's probably safe to be on dexamethasone, and after administering the drug, monitor electrolytes, blood pressure, and weight.